Welcome to our channel Medicine Review and Knowledge, dedicated to providing comprehensive reviews on various medications and healthcare products. Today, we have an important topic to discuss: Mifegest Kit. The Mifegest Kit is a combination of two medications, Mifepristone and Misoprostol, commonly used for medical abortion. It offers a safe and non-invasive alternative to surgical abortion. In this video, we will provide an in-depth review of the Mifegest Kit and its role in medical abortion. Now, let's explore the Mifegest Kit in detail, discussing its components and their functions. The Mifegest Kit consists of Mifepristone tablets and Misoprostol tablets. These medications work together to effectively terminate an early pregnancy. Mifepristone, the first medication in the kit, is an anti-progesterone agent. It blocks the hormone progesterone, which is necessary for maintaining pregnancy. By doing so, it causes the lining of the uterus to break down, leading to the detachment of the developing embryo. Following the administration of Mifepristone, Misoprostol, the second medication in the kit, is taken. Misoprostol is a prostaglandin analog that helps induce contractions of the uterus, expelling the pregnancy tissue. It's important to note that the Mifegest Kit should only be used under the supervision and guidance of a healthcare professional. They will evaluate your eligibility for medical abortion and provide you with the necessary instructions for its use. The Mifegest Kit is typically administered over a span of a few days, following a specific regimen. The recommended dosage and administration instructions may vary depending on individual circumstances, so it's crucial to consult with your healthcare provider. Usually, Mifepristone is taken orally on the first day, followed by Misoprostol tablets that can be taken either orally or vaginally after a designated time frame. Your healthcare provider will guide you through the process and provide any necessary follow-up care. The Mifegest Kit has been proven to be highly effective in terminating early pregnancies, generally up to 10 weeks from the last menstrual period. Studies have shown success rates of around 95% when used as directed. However, like any medication, it can have potential side effects. Some common side effects of the Mifegest Kit may include nausea, abdominal pain, cramping, bleeding, and in some cases, headache or dizziness. These side effects are typically temporary and resolve on their own. However, it's important to report any severe or persistent symptoms to your healthcare provider. Undergoing a medical abortion with the Mifegest Kit should always be done under the guidance and supervision of a qualified healthcare professional. If you found this video informative, please give it a thumbs up and consider subscribing to our channel Medicine Review and Knowledge for more educational content on healthcare-related topics.